welcome in. This is Brian White. I'm the current in-house chair of the in-house practice group for the American Health Law Association. And I'm also the general counsel and vice president at Wake Forest University. I'm joined here today with two just amazing people in both the world of health law and also just great colleagues and friends for some time. And similar to the collegiate athletic associations and conferences, we're going coast to coast today. I think you can call Ohio one coast at least. Joined here with Rob Gerberry, who's the Senior Vice President and General Counsel at Summa Health, and also former in-house practice group chair. Last time we were talking salary surveys back in 2019 pre-COVID. And also joined with us today, kind of carrying the heavy water as part of our podcast, is another former chair of the practice group who luckily kind of got sandwiched between us and carried the water for some time, but didn't do a salary survey, but certainly has had a lot of input in what we're about to talk to today. That's Aletheia Lawry, who is serving as general counsel and chief compliance officer at NextCare, and also did a fabulous job, might I say, of working on the in-house program that preceded the annual meeting just this past summer. So kudos to that. I thought it was a great program and touched on a lot of issues for those who are listening to this podcast. Probably would have found helpful if they attended, or if they can jump back and listen to some of that program material. So we're here today to talk about just a few things that's hitting in-house practice for attorneys within the association, but then also to focus in on a fantastic toolkit that we put together just this past summer that's available to those listening and to anybody that would like to purchase it or to get access to it, which is our healthcare in-house counsel salary survey, which really expanded this last year beyond the previous one to focus in on and drill down on departmental resources. About half of the survey focused on just the compensation portion of it, but the second half really focused on the various resources that our in-house groups have access to kind of distinguish and benchmark what some of us are doing, what some of us may not be doing, and areas for potential growth. Now, Rob, I don't know if you want to kick this off, since you back in 2019 pre-COVID headed the survey that preceded this one. But as you looked at this current survey and the last survey that you kind of shepherded through pre-COVID, what do you see are the biggest changes between that survey and this survey that kind of stand out to you?
So thanks, Brian, and thanks for having me today. I think the biggest changes I see is just how much more robust the tool is based upon some of the practice management information that we're able to garner from the survey that's come out. Like you mentioned, it's going beyond just stratification of where people fall around their salaries based upon the type of organization they serve or number of years of experience, into some real deep information that we can use for metrics as we try to manage our in-house practices.
Yeah, and I want to say thank you as we sort of entered into those questions as well. Brian mentioned that I sat on the in-house counsel program planning committee, and one of the things we really tried to do this year was to look at the things that affect us as in-house counsel that's a little different than other healthcare lawyers and others interested in healthcare law that are out there. So we talked a lot about some of the things that figured into this survey, and I'm excited to chat a little bit more about what some of those are and kind of what our thoughts, and always enjoy hearing Brian and Rob's thoughts on those topics as well.
Thank you. And maybe before we dive into the survey a little bit, I'll tell you a couple of things that are happening with the practice group that will hopefully launch our conversation a little bit. One of which is trying to get a little more engagement within the practice group and the communities. And so you may have noticed this past week, Rachel Freeman, who's one of the vice chairs on our practice group, is starting to practice putting out a question a week on there to really understand better the landscape of what we're all working with within our offices. And that first question this last week was, are you hybrid? Are you in person, or are you all remote in how you deal with your practice group? And although that wasn't a question that we were able to ask on the survey, it is one that we're obviously very interested in getting some feedback on. So Aletheia, I think I'm going to toss this one to you. We didn't look at that, but in this industry, what's the landscape that you see at NextCare, and then maybe when you're talking to colleagues, what's working, what's not working, and are you remote? Are you full-time remote? Are you hybrid? Are you going in the office? What are you doing?
Yeah, so I'm hybrid right now, and but I think we definitely have entertained a lot of fully remote. I live 20 minutes from the office, so easy jump in there. One of the things that I've been thinking about when we talk about remote or hybrid, and the other is I really do miss some of that collegiality that we had in office. And I wonder what this is going to look like for us in the future, because at one point where I was during COVID, I made a switch about a year ago. We had all gone home, right? It was 2020, we're home. And when we started to come back, we thought, well, we need to have a legal person in the office every day. And while our colleagues that weren't in the legal department might appreciate that, that kind of didn't give us any of that opportunity to get together. And so as I think about what I think the work environment should look like, I think there's got to be some opportunity for collaboration that can be by Zoom. But if it's going to be in office, I think it's important to have maybe fewer days where you have everyone together, but a longer period of time, and not just the legal department, but having a day where those leaders that we work with on a daily basis are in the office as well, and we can do some of that kind of connection there as well. So that's where I think we may end up is kind of like office days that may not be covering every day a week, but certain office days a month.
Excellent. How about you, Rob?
So right now, our executive team, probably since 2021, has been back in the office full time. Our office is in a corporate office center. We are separated from our hospitals, from our health plan. And right now, I think the challenge I see is still about 95% of my day is spent on Teams meetings, even though I come into an office. And so everyone's looking for that value of that in-person interaction again, but it's not happening to the extent maybe some of us would hope. Our teams that report to the executive team are all hybrid at this point, and we're hearing a lot around employee engagement that people really still want that model. They want that flexibility, to Aletheia's point, to have certain days they're going to be in the office. There may be collaboration days, but they also want the flexibility to be able to work from home other days. So that's a challenge I think that we face right now, is some of the mentoring, some of the connectivity has definitely been lost. How we restore that while at the same time, respecting some of the efficiencies we learned during the pandemic about the at-work home model. That's
great. One of the things that we're doing that I'm hoping is successful, we're actually kicking it off hopefully next week, and depending on when folks can listen to this podcast, hopefully I'm not telling my staff something through a podcast that they would otherwise hear elsewhere. But we're actually creating teams. And so it used to be historically, we have one attorney who's, the research attorney, one attorney that does, real estate, one attorney that does transactional or group. Now we're ramping up our paralegals. I think it was Intermountain, maybe at the annual meeting, that kind of did a presentation on bringing paralegals in and working this team function. And we're going to try to emulate that here at Wake Forest. And so it calls for one attorney and a paralegal to be the dyads over a specific area. And then additional attorneys kind of come into that team. And it's forcing, hopefully, not only some folks to engage in areas they otherwise hadn't engaged in and to get some knowledge base there, but also to see each other more, where those teams will meet on a weekly basis and kind of talk what's going on. And then the other thing that we're kind of baking in there is the team leader. So if it's say research and we're working on clinical research, that team leader needs to know the vice president for research pretty well and is part of that leadership team. And so that kind of helps, because we do have hybrid and some that are remote completely, individuals who can participate via Zoom right with the client and kind of engage on that mission front in that perspective. I saw you nodding, like, is it something? Yeah.
Yeah. Well, if I can hijack for a second, and sure. This is one of the things I've struggled with, and since I have two colleagues on the line who I know have probably thought through this and have great ideas as well, as we talk about that, and you're talking about teams and you're talking about team leaders and not sort of having attorneys assigned one place or another, one of the things I've always struggled with a little bit is as organizations get bigger, there's really a thought that maybe we will start specializing, right? So you're going to have the attorney who does clinical research, and you've got one attorney who may do your transactions, and one does your real estate, and one does the rest of that. And I worry some about our profession, since it is the Health Law Association, how we're growing the next generation of legal leaders in healthcare. If we start getting so specialized, and I don't know about you, the two of you, but if I hadn't had kind of the breadth, I'm not sure how you come in and you advise your client, right? Because I think so much of what we do isn't just traditional legal work. So what are you all thinking about that specialization versus trying to get some breadth to the next generation of leaders?
So I'd piggyback on that comment by saying, health systems right now are acutely facing financial headwinds, and everyone's challenging our model and saying, how do we look at our cost structure? The challenge is they're saying, all right, let's spend less money on outside counsel. And the outside counsel we primarily use, we have 5 in-house lawyers or specialists. But even if we said, let's bring in a human resource specialist that does all the different things that we need, ranging from workers' comp to ERISA work to immigration work, there's not that one person who fits that bill. Or if we ask somebody to come in as our research, outside counsel or in-house counsel, then replacing some outside counsel, those research counsels could be patent lawyers. They could do licensing, transaction, trademark work. There's a bunch of different subspecialties, even within the specialty. And so that makes it, I think, very hard as we look at how do we properly diversify our inside and outside teams in a way that's cost effective and efficient.
Yeah, I think that's a right in line with where we're thinking too, Rob. And there's a thing my grandfather taught me a while ago, which is, we were working on his flooring in his house, and he had to bring a contractor in to help with something. And his response was, look, we're going to learn from the contractor how to do this. And I think that's the approach you have to take to, diversifying the in-house team, but then also reducing outside expenditures on outside counsel. Is that, when you bring an ERISA attorney in, or you bring a tax attorney in, if you build some bandwidth so that you're learning from them the area, then the next time that issue comes up, it may be something you can handle in-house rather than sending outside. And then with that team approach, again, you have to have a large enough team to be able to do it. But with the team approach, one thing we found talking to my team is, not all of them want to be a general counsel, but they all want to see growth, right? And so getting exposure and being more of a generalist and getting exposure to different areas is something important to them. So trying to find ways to allow, someone who deals with, payer audits or other types of financial issues, exposure in, patient areas, or litigation is something that they may or may not like, but getting that exposure allows them to sell themselves as they grow in their profession and grow in different areas. So that's kind of the mindset there.
I thought it was really surprising this time. Only 2% of the survey participants said they expected their legal departments were going to shrink. And it just struck me because I think as healthcare organizations, we're still all struggling with financial, and certainly with financial models and knowing what the future is going to look like. So I think that's, I hope that means they've realized again the importance of having legal advice and counsel. But is that what you guys are seeing too? Sorry, I just, all these questions come up when you guys say this exciting, interesting stuff.
No, and I think maybe to couple that question, and we'll toss this to you, Rob, since we're both speaking. I think to couple that with, with that workforce and what it looks like, do you feel like your team has the skill sets, right, to be able to handle that as the financial pinch continues to pinch stronger and that pressure to not send everything outside? Are you feeling that on your own team to deal with those issues?
Yeah, and I'd say off of the 2% comment, I think the challenge we face is unless, we've seen workforce costs grow exponentially across the enterprise of health systems, and our rates have not kept up of what we're being reimbursed both from the government and from commercial payers. So a really complex issue boils down to that. Other industries have been able to flex their pricing. Our industry hasn't. And yet we realize the magnitude of clinical care that's needed in our community. And so we're not cutting at the bedside. And so people automatically turn then to the corporate side of the house. And so when you get those kind of blunt, every corporate department needs to reduce X%, I think that's the real challenge that we'll probably see as these surveys come out in the future. How much are people being held to those kind of numbers? But the demand is definitely there, and our work isn't shrinking at all. And so how do we figure out how to keep things at the right price point across our inside and outside counsel is really the challenge that I think our team and other teams have. What should we be keeping in-house and doing ourselves? What should we be sending out? How do we create more effective partnerships with our outside counsel so they understand our cost pressures and we understand theirs, either retainer arrangements or some kind of budgeting so that you're just not opening up that legal bill at the end of each month and there's a surprise. It's very hard, whether it's transactions or litigations or compliance investigations for outside counsel, to say, all right, I can give you a hard and fast number, but really trying to come up with something bilaterally where we're having deeper conversations about what the spend is really going to be. And then for us, we may have to consider, all right, this is the firm we've always worked with, but we don't have the ability to pay that pricing anymore. We may have to look at alternatives. And that's some of the hard decisions, I think, that are coming out of, the current challenges we see.
Yeah, and I'll tell you, Rob, you're a little, I forgot to mention at the beginning that Rob's on the board of the association. So, he's high above all of us, but us at the PG level, we've been talking a lot about how we can provide that content, the best practices around working with outside counsel, levers to pull, things like that. And certainly that's a content that we're hoping to be able to deliver to the practice group in the coming year. Aletheia, I'm going to toss this to you and maybe a little bit of a tease to the report. Without going into too much detail into the report, because we want you to pick it up and read it, there is one of the questions we asked, and the trend over the last couple of decades, at least that I've looked at while I've been practicing, has been as there's that financial pinch, and you start figuring out, what can legal do that's outside of the legal sphere, right? That can rather than having a compliance officer, maybe compliance should report to the legal, should legal oversee compliance and vice versa. But you're seeing these new areas that are kind of popping up that we surveyed folks on, and you can kind of see those in the report of what those areas are. You've seen them, Aletheia. Do any of those stand out to you as like, wow, I didn't think that people were throwing this within the legal department, and this is something that the legal department should be overseeing? Anything shock you when you read those?
Yeah, well, I think, I think they're just asking us all to do a little bit more. But I like that in some ways, right? Because I think it also shows that we've got other C-suite leaders that are saying legal really serves a function that isn't just reviewing your contract or saying, can you get out of this, or what's our exposure with related to something else. I think traditionally risk management continues to be really big with compliance, but regulatory accreditation and licensing. I was surprised by how many people have that rolling up into legal. But I think that's actually a really interesting and good move for legal departments, and a place to both expand their reach, but also get involved on the front side to keep things from going wrong on the backside. So much of that regulatory accreditation and licensing crosses over into risk management and compliance and legal, and those fields that have been a little bit more traditionally under legal's purview. So I think that one surprised me, but I think it's a good move in the industry.
And as I looked at those different areas, one of the things that's probably unique in our organization, but I see expanding in others, is those areas do start to cross over. The independence that the legal department brings, we're being asked to do more. So I have 3 different kind of pods of services that report to me. I'd say the traditional legal functions of legal, compliance, internal audit, risk management, insurance. But then a second pod would start with government relations, where we're involved in health policy issues, but that's morphed into a pod now of community benefit, community relations, and our diversity, equity, inclusion work. And then the third pod is related to our physician contracting. I have our physician modeling and contracting, so that the legal department would help set those benchmarks and not allow the departments themselves to be the ones setting those numbers. I also have our protective service force, as we saw some of those issues that have played out over the last several years. They wanted us from a risk management perspective to oversee the protective service department. And then lastly in that pod is kind of our governance function. What are we doing to
I'm
support
imagining Rob's team with badges, right?
Different
out
hats.
in his hospitals, his force out there. But
Well, what Rob failed to mention, I think he also oversees the Summa golf team too, right?
Most important of all functions. That's
Most
right.
important all function, yeah. So, another area of the report that I think is, well, we talked about a lot at the annual meeting. There were a few breakout sessions of the in-house group and at the annual meeting, and something that I think, again, as the financial belt continues to get tighter, we're asked to be held accountable both for the size of our staff and the work that we're doing. And so, one of the areas we asked about was, are you engaging in KPIs? And so there's some great data in there about who's using KPIs, what type of KPIs they're using. But curious of the panel here, Aletheia, Rob, are either of you measuring accountability through KPIs or other ways within your institutions?
So during the pandemic, I think it became even more important as people were at home to try to figure out how do we demonstrate our value. I think some of the items we saw in the survey, we've historically done things like number of contracts reviewed, what's our turnaround time, how do we manage our legal spend to a certain budgetary number. But we're also seeing some of the new measures I saw alluded into in there. How are we providing education back to the organization on key topics? How are we managing compliance investigations and making sure that we're making that program as robust as it can be? So we're constantly trying to network with peers, and that's what I love about AHLA and our in-house practice group, to be able to connect with people across the industry to see, all right, what have you tried to measure? What analytical tools have you used to capture that information? And how do you share back with your board and your C-suite the value that your legal team brings?
And how do you align it? I mean, I think that's another really interesting thing that some of it was touched in the survey, but I certainly hear from a lot of people is how, when your health system or your board sets goals, how do you show that legal's aligning with those as well and make your KPIs match up with moving the organization forward as well? And so I think we're going to see more and more of that. And it's always interesting to see what other people are doing and how we're all trying to navigate through that.
And to build on Alethea's comment there, I think we've historically had a lot of objective metrics, but now we're starting to get some more subjective metrics as we do client surveys and start to hear more from our team on, are they a true partner to us? Are they solution oriented? Are they helping us achieve our business goals? And so we're trying to measure that through those survey tools.
Do you use a specific tool, Rob? Just curious.
Or
is it homegrown?
Yeah.
Homegrown. Yeah.
Homegrown set of questions that we try to morph each year, and we try to keep it to a reasonable amount so we don't get survey fatigue. But I think it's been really helpful for our team to see those responses.
I've seen those go also in with like employee satisfaction surveys and those kind of things. Are you tying in with that, Rob, at all?
We kind of conduct that work separately through a vendor. This is really, directly to something our group comes up with and sends out on our behalf.
Your specific clients. Yeah.
So the good old days of just trust the legal department no longer in place. You got to actually measure ourselves, hold ourselves accountable, and learn how we can improve, right? So I have one last area I'd like us to jump into here before we go, and that's back to the salary side of the survey, and a unique area that we dove into a little bit in this current survey that we did in 18 was the idea of severance, right? And so as we tend to be focusing on the belt getting tighter with the finances. We're still in a hot time of system integrations, and quite frankly, the idea that sometimes people don't like the advice that we give them. I'm curious, in your institutions or across, are you seeing any trends or any conversations both at the high level as the chief legal officers, but then also with your teams around building in some types of severance or more contractual type pay for your attorneys?
So for us, I definitely think, Brian, it has become an issue, because I can even think back to when I left the law firm setting and came in, I said, what more stable industry than healthcare? They're not going to move my organization out of town. So why would you ever need to be concerned about it? But you're right. This is a rapidly evolving industry right now. And I think when we look to keep talent and make sure that folks feel protected in the role and the advice that they give, how do you create the right reporting relationships? And then how do you create some sort of either contractual or policy around severance so that people know if there's a change in control event or some other event that precipitates a change in someone's employment, they have some protection. I think it is something that's going to be an ask going forward with the evolution of healthcare.
And I would say I sort of see the flip side of that as well. It is, I think we need to be looking at it more as an industry, particularly in areas that are not for profit, right? I think there's always a balance, and I certainly don't think that for-profit companies are out there trying to give bad health care or break the law. But I think there's just inherently a little more pressure when they get delivered news, the boards get delivered news that doesn't align as well with what their mission is. And so I think it's important for the industry to start recognizing the need for that. Maybe so not quite so much on the legal side, but I think a lot of us have compliance reporting up and being able to offer some protection so that we have an open dialogue with leadership and with the board, and people aren't worried that they can't have that open dialogue because they're scared about losing their jobs. And so I think there was some movement on the surveys this year in terms of what severance looked like and whether severance was available. And I actually see that as a really positive move, I think, for our industry.
Well said, Aletheia. And I'll throw out there that certainly if you get access to the survey and want to share that with your HR department, that's a great way to start that conversation around what should be expected as you bring attorneys on and taking care of your team. So I want to thank you, Aletheia, Rob, for jumping on and joining us here as we talk. I know there's a lot of great things happening at AHLA and with the in-house practice group. I want to send a special shout out to all the vice chairs on the practice group. We've put in a lot of work this year to bring some great content to everyone at AHLA. Also, with regard to the survey, it could never have been put together without the work of and the partnership that we have with Arizona State University, in particular, the College Health Solutions and Biostats core, which is part of there, and the great work that Jonathan Kirka produced there. So thank you all for listening and joining, and we'll catch you next time.